Assalamualaikum warahmatullahi wabarakatuh and very good day. Today we continue with the part 2 chapter fat soluble vitamin. Okay, for fat soluble vitamin we have four main type A.D.E.K. So we have covered vitamin A in part 1, so we will cover vitamin D, E and K in this chapter for part 2. So today we learn about vitamin D. So only a few food naturally contain cholecalciferol, which is vitamin D3. Okay, fortified food contain vitamin D3 and D2. What is fortified food? So fortified food are those that have nutrient added to them that don't naturally occur in the food. Okay, so in natural, the food had no contain vitamin D3 and D2, but due to manufacturing process, okay, they add vitamin D in this food. For example, again, milk is often fortified with vitamin D and calcium may be added to fruit juice. Okay, these foods are meant to improve nutrients and add health benefits. Okay, widely distributed in the diet such as salmon, eggs and milk. So in natural, okay, vitamin D can be found in salmon, egg and milk. Okay, let us look at this diagram. So sunlight have a UVB. What is UVB? UVB is stand for ultraviolet B radiation. So sunlight is a natural source of vitamin D because this energy can convert vitamin D precursor in our skin to active form of vitamin D. So first stop of the process is in our liver, whereby the vitamin D, the precursor of vitamin D, will pick up extra oxygen and hydrogen molecule become 25 hydroxy vitamin D. So usually doctors will use this substance to indicate whether we have sufficient or insufficient vitamin D in our body. So next, the 25 hydroxy vitamin D will be carried to our kidney and pick up extra oxygen, okay, and form 125 dehydroxy vitamin D, which is also known as calcitrol. This is the active form of vitamin D. So our body can only use active form of vitamin D. So we have to turn vitamin D precursor into active form before using it. Okay, there are two main sources of vitamin D. First is sunlight, whereby we can naturally find vitamin D from UVB exposure. Okay, if you exposed to sunlight, so UVB from sunlight, okay, energy from the sunlight will turn vitamin D precursor in our skin, okay, into active form. Okay, if you want to get the vitamin D from diet, okay, they also have some source of vitamin D. For example, from plant-based, okay, ergocalciferol T2 from ergosterol, and animal-based food such as cholecalciferol D3 from cholesterol. So this is from the diet or supplement. So D2 and D3 will be carried to our liver and form calcidiol. So this is the form of inactive vitamin D that usually used to measure in the blood. Okay, also known as 25 dehydroxy vitamin D. So doctors will diagnose whether we have deficiencies of vitamin D by measuring this substance in the blood. So this substance will carry to our kidney, okay, to turn it into active form of vitamin D, okay, calcitriol. Okay, this active form of vitamin D will be used in our body. Okay, next we look at the function of vitamin D in the body. One of the main functions of vitamin D is to maintain the calcium and phosphorus level in blood. Okay, vitamin D aids in the absorption of calcium, helping to form and maintain strong bones. Okay, the next function of vitamin D is to maintain normal function of parathyroid gland as well as immune system. So vitamin D is actually can regulate the parathyroid hormone released by the sheath cells and mediate parathyroid hormone stimulate bone reabsorption. So if you can see here, this is the diagram of thyroid gland. So like a butterfly shape. Okay. This is the right loop. This is the left loop. So if we look at the back view of thyroid gland, there are parathyroid glands. Okay, the yellow color, the small circles, yellow color small circle. 1, 2, 3, 4. Okay, parathyroid gland. So this gland is responsible to secrete out the parathyroid hormone. So vitamin D regulate, okay, the secretion of the parathyroid hormone. Okay, apart from that, vitamin D also important for immune system, as the vitamin D receptor is expressed on immune cells such as B cell, T cell, and antigen presenting cells. And these immunologic cells are all capable of synthesizing the active vitamin D metabolite. Vitamin D has the capability of acting in an autocrine manner in a local immunology milieu. Vitamin D can modulate the innate and also adaptive immune response. So this is the importance of vitamin D for our immune system. Okay, the third function of vitamin D is to prevent certain type of cancer and heart disease. Many studies show that high level of vitamin D or high intake of vitamin D can reduce colorectal cancer. Okay, let us look at the recommended vitamin D intake. So for adult men and women, okay, the recommended vitamin D intake is 15 microgram per day. Okay, by assuming there is no vitamin D is synthesized in the skin through naturally but exposed to the sunlight. Okay, same amount for children and infant, and increased requirement for older adult, about 20 microgram per day, and no change for pregnant lady or lactating mother. Okay, let's look at the effect of deficiencies of vitamin D, meaning that lack of vitamin D, okay, and also the effect of excessive intake of vitamin D, which is referred to toxicity of vitamin D. Okay, first we look at the deficiencies. Lack of vitamin D intake, okay, so will result in certain health issues or health problems such as ricket in children, osteomalacia in adults, and for a certain population at higher risk of getting health effect. Okay, so toxicity not caused by natural food and or sun exposure, but usually the toxicity caused by over supplementation, meaning that vitamin D that obtained from the diet. Okay, over fortification pose risk means people who are taking or get the vitamin D from the food that fortified with the vitamin D. For example, as I mentioned earlier, okay, milk usually fortified with vitamin D. So toxicity usually due to oversupplementation or overfortification. Okay, the upper limit, UL stands for upper limit. So this is the maximum dose for vitamin D. Okay, for adult, 50%. Sorry, 50 microgram. Okay, per day. Okay, so this picture shows the recap. Okay, CAT is a skeletal disorder that caused by a lack of vitamin D, calcium, and phosphate. Okay, as we all know, okay, vitamin D can assist the calcium absorption. Okay, so if we drink milk fortified with vitamin D, it will improve the development of a strong bone. Okay. So lacking of vitamin D, phosphate, and also calcium will lead to ricket. Okay, so ricket people who are having ricket or people with ricket may have weak and soft bones, stunted growth, and in severe cases will cause skeletal deformities. Apart from ricket, osteomalacia also one of the health problems related to lack or deficiencies of vitamin D. Okay, so osteomalacia is often occurs among older adults that can lead to fracture. Okay, the third type of fat soluble vitamin is vitamin E. Okay, so several naturally occurring forms are found in food, and only alpha tocopherol can meet human vitamin E needs. Okay, and it widely distributed in the diet such as sunflower seeds, almond, safflower oil, and olive oil. So this source of food or source of vitamin E also have unsaturated fatty acid. And if you remember in previous chapter, we covered lipid. One of the type of fatty acid is unsaturated fat, and this type of food or vegetable oil also rich in vitamin E. So it is good for us to take this source of food to maintain our healthy body. Okay, like other fat soluble vitamins such as vitamin E and D, vitamin E also incorporated with lipoprotein, which is kilomicrons. Okay, so they need a protein transporter or lipid transporter in our body. Okay, so most vitamin E is taken to the liver, and lipoproteins deliver vitamin E to the tissues. Okay, vitamin E function primarily as a fat-soluble antioxidant. Okay, if you remember, the previous type of fat-soluble vitamin also carry out the same function, which is antioxidant, meaning that they have properties that can reduce the risk of having cancer. Okay, Also necessary for reproductive function in humans. So if you are planning for pregnancy, people who are planning to have a children or child, so they are encouraged to take vitamin E. Okay, this diagram shows the phospholipid bilayer in our membrane cells. So, vitamin E play an important role as an antioxidant. How they carry out the function. So, let us see the diagrams. Okay, this is the phospholipid bilayer. So, in this part, okay, the right side is referred to the undamaged membrane, whereby the left side is referred to the membrane that already damaged due to presence of free radicals. So free radicals are very most commonly factors that contribute to cancers. Okay, so what will happen if you eat or we take a lot of vitamin D? So vitamin D will neutralize the free radical in the same membrane. Okay, so it protect. Okay, vitamin E protects unsaturated fatty acid in cell membrane by neutralizing free radical. So free radical can be come from very different sources. For example, stress also can be one of the factors that increase the free radical in our body. So if we want to reduce risk of having cancer, we have to take a lot of vitamin E because it play important function as antioxidant. Okay, let us look at the recommended vitamin E intake. Is 7.5 milligram per day of alpha tocopherol for adult women, 10 milligram per day of alpha tocopherol for adult men, and the requirement not increase among pregnant women and also lactating women. Okay, so for infant and children, about 3 milligram per day. Okay, what are the effects of lacking of vitamin E? So they are very rare, but however, it also can be occurred. Okay, if the person having fat malabsorption, which means they are having problem with absorption of the fat. Why? Because vitamin E is fat soluble vitamin that can dissolve in fat. So the absorption of vitamin E need fat. Okay, so people with fat malabsorption will have problem with absorption of vitamin E. Okay, inherited abnormalities of vitamin E metabolism also having problem with these issues. So people who are having genetic problem, which is abnormality of vitamin E metabolism, they may also have this problem. Okay, and protein energy malnutrition also for people who are at higher risk of having the problem with the vitamin E deficiencies. Newborn are at high risk. For example, hemolytic anemia possible among them because what are the like let us look at the meaning of the hemolytic anemia. Okay, the hemo is referred to the hemoglobin in red blood cell. Lytic is a lysis which is destroyed or breakdown of the hemoglobin. Hemoglobin. So anemia is a disease or disorder that related to destroy or destruction of red blood cell, hemoglobin in red blood cell. So the newborn baby at higher risk of this problem if they are lacking of vitamin E. Okay, so membrane damage and neurological problem are also symptoms of having deficiencies in vitamin E. Okay, relatively, there's non-toxic if we take a lot of vitamin E. However, large doses of vitamin E may interfere with blood clotting. Blood clotting is a process whereby we have injury, so to stop the blood from flow, okay, the flow out, okay, so we have to stop it, okay, by blood clotting process. So vitamin E may large doses of vitamin E may interfere the blood clotting process and also function of vitamin K. So we will look at the function of vitamin K in the next subsection, whereby actually vitamin K is very important for blood clotting process. Okay, there is a lack of scientific evidence to support health claim by supplementation. Okay, the upper limit, which is the maximum dose for vitamin A is 1000 milligram per day. Okay, the last type of fat-soluble vitamin is vitamin K. Phyllocyanine. Okay, vitamin K1 found in plant is the primary dietary form. Okay, quinine can be synthesized by bacteria and widely distributed in the diet such as mustard greens, kiwi, soybeans, oil, lentils and carrots. So this is the source of food that contains vitamin K. Quinine, which is the vitamin K2, are found in fish oil and meats. So we have to take this type of food to get the vitamin A from the diet. One of the main functions of vitamin K in the body is for blood clotting. Okay, so vitamin K is a coenzyme for the production of thrombin and other blood clotting factors. So vitamin K are required for prothrombin formation. Okay, so thrombin is used for fibrinogen to become a fibrin. What is fibrin? It's referred to protein threads that form the webbing of the blood clot. So this is very important for us if we have any damaged tissue or injury. Okay, so may be involved in health of bone and blood vessel and useful for the prevention of treatment of osteoporosis. So this is the other function of vitamin K. Okay? Vitamin K involved in preventing and treating osteoporosis. Osteoporosis, as we all know, is related to bone health problem. So if we want to avoid the osteoporosis, we have to take calcium, vitamin D, and also vitamin K. Okay, the recommended vitamin K intake 65 per microgram per day for adult men and 55 microgram per day for adult women. And this demand increase during pregnancy and lactation. The vitamin K produced by bacteria in the gastrointestinal tract contribute to the needs, but is not well absorbed. Okay, as we all know, we have two forms of vitamin K, K1 and K2. So the vitamin K that produced by bacteria, which will be not well absorbed. So lastly, we look at the deficiencies of vitamin K effect and also the toxicity of vitamin K. So the vitamin K deficiency may lead to abnormal coagulation is a symptom. Okay, so the major symptom is abnormal coagulation. Coagulation is actually referred to the blood clotting process. So abnormal coagulation process will lead to blood flow, okay, blood loss during injury or accident. So the result from fat malabsorption and long-term use of antibiotic. So this is the source of factor that they contribute to the deficiencies of vitamin K. Okay, most common in newborns. Toxicity. What happens if we take a lot of vitamin K? So the no documented the side effect up to 370 microgram per day, and there's no upper limit set maximum dosage for vitamin K, and high dose can interfere with the anticoagulant drugs. So anticoagulant is the agent that prevent the protein process. Okay, lastly, this table is very important for us to know because this is a summary of fat-soluble vitamin covered in part 1 and part 2 of this chapter. Okay, nutrient refer to the type of fat-soluble vitamin A.D.E.K. So this second column should refer to function. So each vitamin have different function. Okay, for example, vitamin A is very important for normal vision, healthy skin, immune system, and as well as the bone and tooth growth. Okay, vitamin D is very important for the absorption of calcium, which is also important for development of bone. Okay, vitamin E is important for antioxidant to reduce cancer, okay, risk of cancer. Okay, protect cell wall as well as protect cell wall. Okay, for vitamin K, okay, needed for the proper blood clotting, which is very important during injury. Okay, so this the third column is for sources of vitamin A sources from food. And how do we get or obtain the vitamin from the diet? Okay. For example, vitamin A, we can get it from animal based such as fortified milk, cheese, cream, butter, fortified margarine, egg, and liver. And for plant based, for example, leafy dark green vegetable, dark orange fruits, and also carrot. Yeah, very important for you to remember. Okay. Vitamin D sources from diet, for example, egg yolk, liver, fatty fish, fortified milk, fortified margarine, okay, and also natural source which is related to the sunlight, okay. Vitamin E sources, polyunsaturated plants oil such as soybean, corn, cottonseed, sunflower oil, and others. For vitamin K, source of the vitamin K, for example, leafy green vegetable in the cabbage family, milk, also produced in intestinal tract by bacteria. So that's all. Thank you for your attention and goodbye.